Hey everyone, we're here with Dr. Michael Kemper from Georgia Urology, and he is a center of excellence in the AMS 700 inflatable penile prosthesis. And Dr. Kemper, why don't you tell us a little bit more about yourself and your experience with erectile dysfunction treatment and in particular the penile implant?
So I have had a special interest in men's health and treating men's health since I became a urologist. I did a fellowship in men's health down in Miami for a year after I finished my residency training. I have a practice here in Decatur that is focused on men's health, both enlarged prostates as well as erectile dysfunction, and a special focus in that.
So Dr. Kemper, tell us a little bit about erectile dysfunction. What is it? Is it common? Is it normal?
So erectile dysfunction is one of the more common things that happens to men as they get older. There are a lot of different reasons why men can have erectile dysfunction, really three main ones. There is psychogenic ED, signals aren't getting sent from the brain down to the penis properly. Those are things like low testosterone, certain medications. Then there's neurogenic ED, so signals aren't getting sent from the spinal cord out to the penis properly. That's things like poorly controlled diabetes or spinal cord injuries will cause that. And then there's vascular ED, which is where there's not enough blood getting into the penis, or blood gets in but it leaks back out. You can't maintain it there. And that's usually due to things like diabetes, high blood pressure, heart disease. The vast majority of men will have some component of a vascular ED.
And when a patient comes in to see you about erectile dysfunction, what do you guys talk about, and ultimately what treatment options do you give them?
So mostly it's what have you tried, what's causing it, and what we go through the options. And there are really four options for treatment of erectile dysfunction that actually work. So there's pills, tadalafil, sildenafil. For people where it's more severe, there are injections, so medicines you inject into the penis to give you an erection. There's something called a urethral suppository, which you can put inside the urethra that causes an erection. It doesn't work all that well in my experience. It tends to cause a lot of burning with urination, but it is an option. There's a vacuum device, so the old penis pump, you put it around the penis, it draws blood in, you put a ring at the base of the penis to hold it there. And then there's the penile implant. So penile implant is a device, the AMS 700, that goes inside the body. It gives you an erection whenever you want. So it's a pump that goes inside the scrotum, two cylinders that go inside the penis, and a balloon that goes in the belly. Whenever you want to have sex, you pump the pump, it gives you an erection. The erection lasts as long as you want. Whenever you're done, you press a button on the pump, squeeze the penis, the erection goes away. It is something that works really reliably every time you want to have sex. It's something that's a relatively brief procedure. It's about 45 minutes. You go home later the same day. 4 to 6 weeks later, folks are back having sex again.
How about the satisfaction rate of the penile implant?
So the penile implant is the thing that we do that has by far the highest satisfaction rate of any treatment for erectile dysfunction. It's well above 90%. Most men who come to me for this have already failed medicines. We frequently try and fail injections. And this is the thing that works. It is by far the highest satisfaction rate of any intervention I have for erectile dysfunction. There is not a right time or wrong time for surgery necessarily. And every man, this is a decision you have to make for yourself. It's not something that you should be talked into. This is one where, this is something that works. This is something that works reliably. This is something that is safe. This is something that we can typically, it's covered by Medicare. It's covered by most commercial insurances. So this is something that when you're ready for that, something that's going to work, this is an option. I think that for a lot of guys who, once you've tried the pills and it's not working, they're not going to suddenly start working again. Once you've done the injections and they don't work, they're not going to start working again. At a certain point, if you've tried the easy stuff, this is something that can be a solution that is surprisingly easy in and of itself.
All right, well, thank you very much, Dr. Kemper. Really appreciate your time.
Yeah, thank you so much for having me.